So many of you, excellent. So I'm Georgie, I'm the 5K Away operational manager. I'm just saying hello and doing a quick introduction, then I will hand over to the lovely Kirsty and Zoe. So I have been doing this role now for just over a year, and unfortunately we haven't had any of our actual 5K Away groups. For those of you that don't know, 5K Away is an initiative linked to Parkrun provided by Move charity, linked to Parkrun groups, but unfortunately Parkrun hasn't been on during the pandemic, and so we have tried to use that as a challenge into an opportunity, and now we've got things like these brilliant workshops. So I'm just going to go through quick admin things, just to, like I said, up to you if you want to keep your cameras on. Great to see you all, but no worries if you don't want to, but please just stay on mute just to avoid the background noise. But it'd be great if you would like to use the chat box, so just over here I'll just say hello, to interact through that. If you have any questions for Zoe and Kirsty, everyone can type in the chat box. That would be great to say hi and hear from me. This workshop will be recorded, but you can only see the people that speak, so don't worry, you won't see or hear or see anything you type or anything like that, just so then we can pop it on our YouTube channel afterwards. So if anyone you know that couldn't make it, they can watch it on there. And yeah, hopefully we'll have some time for some questions at the end that you can type in the chat box. So yeah, we've done a few workshops so far. We started, because we realised we wanted to provide some support for people living with and beyond cancer, whilst our 5K Away groups couldn't take part, and because we realised how many excellent professionals we have in our community who are very happy and willing to share their brilliant knowledge. So far we've had one on cancer-related fatigue, goal setting, exercising with a stoma, and exercising during chemotherapy. So if you're interested and want to catch up on any of those, they're all on our YouTube channel. So without further ado, we'll go on to this workshop, which will be super exciting, led by Zoe and Kirsty. I can still see them, which is excellent. They're waving at us. And Zoe, just as a quick introduction, Zoe and Kirsty are two of our 5K Away ambassadors as well. And together they manage the Prehab4Cancer programme in Greater Manchester. And Zoe is the programme lead for the Prehab4Cancer programme, and Kirsty is the Greater Manager Active Programme Manager. Have I said that right? No, Greater Manchester Active Programme Manager, sorry Kirsty, for the Prehab4Cancer programme. Anyway, I'll let them do a little bit more of an introduction. So we're really excited about this workshop, and hopefully I can now invite them to speak. Let's just double check. Kirsty, can you?
Yeah, hi.
Excellent. And Zoe?
Hello, everyone.
Excellent. And I'm just going to make you the host there, Zoe, so then you can take over.
The power.
Thank you so much. And I'll be quiet for a while now. Over to you both. Thank you.
Right, I'm going to just share my screen and share the presentation we've got for everybody. Hang on a second. Can everyone see that?
Perfect. Yeah.
Silence is golden. Yeah. Okay.
Ask for some thumbs up.
Good stuff. Right, so I'm going to hand over to Kirsty to start.
So thanks for that, Georgie. I quite like my new title of Greater Manager. I quite like that, although it is Active Manager. But if you want to promote me, you can go ahead and do that. So that's fine. So me and Zoe today are going to talk to you on the importance of exercise and physical activity in preparation for surgery and or treatment, or in shorthand, prehab. Because that's what we do. We also do rehab as part of our program as well, which we'll get onto. And we're gonna show you the GM model, how we do prehab and what works in Greater Manchester. It's an example of a model, and like I say, it works for Greater Manchester. So we'll be talking a lot about that. Then we're going to go on to talking about exercise and physical activity and what is it, and what can you do if you are coming up to your surgery or treatment. and a few top tips from people that we work with in the Prehab4Cancer program. So that's going to be the structure of today. In good old Zoe and I fashion, we possibly will run over time, but we will try our best. And so if you want to click to the next slide, Zoe. So this is me. So my new title, given to me, bestowed by Georgie, is the Greater Manager of the Prehab4Cancer program. Title was the Prehab4Cancer program manager for GM Active. I'm an exercise specialist in lots of conditions, but I prefer to focus on cancer. I'm a 5K Your Way ambassador for Salford. However, we only started in January of the doomed year of 2020, so we only did 2 events, but we are very much looking forward to getting back this summer. I'm a keen runner and learning to love cycling because I'm injured at the moment, so I can't run as much as I like to, so I'm learning to cycle. And a puppy owner, and Douglas, in good old Douglas fashion, is sat behind me here for anybody that can still see me, and he probably will want to star in the show later. And the pictures just show my Worsley Woods, which is the Salford 5K. Then there's a picture of me in bright orange to prove that I do run. And then there's me and Douglas getting very wet on top of a hill near my house, because it's not all about exercise, it's about activity as well, and Douglas definitely keeps me active. And then there is part of our lovely team at our launch day, all dressed to impress in our shiny new uniforms. So that's me, and then I'm going to let Zoe introduce herself.
So hi everybody, it's really lovely to be here today to talk to you all. So I am the Prehab4Cancer program lead, which basically means I do a lot of the kind of organisation side from an NHS perspective in terms of actually how the services come together, the funding, working with all the hospitals and all the managers in Greater Manchester to make it happen in collaboration with people like Kirsty and others. My background is I'm a highly specialist occupational therapist, which is an actual term. It's not me just making that up to make myself sound more important than I am. But essentially, for those that aren't really aware of what occupational therapists do, our job is all around how you support people to live their life despite illness, conditions, disability, and how you actually help people to engage in everyday occupations, whether it's going to work, getting up, getting in the shower, all the things that you'd be doing in your everyday. OTs are very concerned with making sure that you can still do that and have a really good quality of life regardless of any kind of condition that you might have. So I've been working as an occupational therapist for 13 years and in the NHS, and I've worked with lots of different patients, lots of different people who've got lots of different types of illnesses and conditions, and there's just a few examples down there. My primary focus has been about trying to help people to rehab. So rehabilitation is my kind of clinical expertise, and more recently prehab's obviously been a big focus with the Prehab4Cancer service delivery. So I've got a few photos on there, just me in my uniform many years ago, back in the day when I used to have to wear green trousers all the time, and then also just some nice pictures. So I'm not actually a 5K Your Way ambassador, but I am a big supporter of 5K Your Way, and that's a little picture of me on the right with my eldest daughter Sophie going to a particularly wet version of the Wilmslow 5K Your Way in October. We were all dressed up for Halloween, which was great. And then on the left hand side you've got a picture of the Prehab4Cancer gang at an award ceremony where Kirsty was not made Greater Manager, but she did get a really great award from the King of the North, Andy Burnham, in terms of all the work that she's done around helping people with cancer and exercise. So I'll hand back to Kirsty now.
Okay, so we like to start with this slide because we find it sets the tone for some of our presentations. So it's a perception of exercise really, and some of the barriers that we can come up against, and then some of the challenges that people can feel who are coming up to surgery or treatment. So I often get the urge to exercise, but if I lie down and breathe, it slowly passes, which some days I think everybody feels like that. So it just sort of sets the scene and shows you a bit of the challenges that we may face as the professionals, encouraging people to exercise, but also that you may face if you are thinking of exercising and you are somebody who's affected by cancer. So if we go to the next slide. Zoe's going to very expertly click through our slides. There'll be some surprise animations on some slides as well, Zoe, which I don't think I've warned you about, so sorry about that. So what is prehabilitation? So we all are familiar with the word rehabilitation. Prehabilitation is becoming more useful in our terminology, and we are getting used to it a bit. But if you've not heard it, it's the preparation for physiological and psychological challenges of cancer treatment and or surgery. And this graph, it's a Macmillan graph, which was published in Improving Cancer Care paper that they did. It shows that there's a baseline, which is where everybody starts. So when somebody's diagnosed and we do an assessment, it's a baseline. And it demonstrates that without prehabilitation, once treatment and surgery hits, there will be a decline, but the green line at the top is indicating that if we can improve somebody before that treatment or surgery, then the decline is less. And also they get back to above baseline, whereas the blue line at the bottom is somebody without prehab. So you can see that their decline, it's the same rate, it does take the same hit on the body. But we get to this point that then rehabilitation could start. So it's also highlighting the importance of rehab, and that's why our program is prehab and rehabilitation. So once rehabilitation starts, we can then get a prehabber up to baseline and even improving on baseline. Whereas if we've not had any prehab, then that rehab becomes a lot more, and especially if we've not had any prehabilitation, it's an even bigger mountain to climb, if you like. So it's a really good demonstration of why both prehab and rehab are essential in cancer care, if you like. So if we go to the next slide. So the preparation can include multiple factors, and we look at the ones highlighted in light blue are the ones that we specifically look at in the prehab program, but we have a bigger team around us that look at a lot more. So we've got things like medical optimization. So that's the clinical teams making sure that anemia is taken care of and things like that, and everything's stable from a medical point of view. There's a pharmacological optimization. So if you think about somebody controlling type 2 diabetes or other comorbidities, it's very important to get pharmacology in there to make sure that they are optimized from their perspective. Then you've got the stuff that we look at as the wider Prehab4Cancer team, and that's nutritional status, exercise and functional capacity, strength, and that's both muscular strength and muscular endurance, psychosocial well-being, and then you've got things like smoking cessation and drug and alcohol abuse cessation, which can also support prehab. So that's by no means a definitive list, but it's a good starting point. And at the bottom there, like we've just said, the prehabilitation and rehabilitation are essential for reducing the future needs of people with cancer. And that was from the Independent Cancer Task Force in 2015, who set out a 5-year strategy for cancer. So it's indicating that not only rehab, but prehab is essential for cancer care. Okay. So that's prehab in a nutshell. Very, very quick explanation of what prehab is, but it's good to know what it is, but why? And this is a benefits page. So there's lots and lots and lots of benefits. We could have gone on for 3 or 4 slides. We could have probably done a whole hour on the benefits, but we tried to pick some that are really salient. So for surgery and treatment, we're looking at things like shortened and less complex recovery times, potential reduction in length of stay in hospital, reduction of treatment-related complications and side effects, improving adherence and completion of treatments, and that's things like chemotherapy and immunotherapy. There's a potential reduction in toxicity of some treatments. There's improved cardiorespiratory function, which then obviously impacts on the less complex recovery. And there's a reduction in the impact of sarcopenia, which is muscle loss due to conditions, and cancer patients have a lot of unexplained sarcopenia, so that's really important to try and get on top of that and reduce that muscle wastage. And then we've seen that prehabilitation can improve somebody's rehab outcomes as well, and the longer term benefits of the prehab, including rehab, is the improved quality of life, the improved functional capacity, so that's the ability to be able to do the daily tasks that you have to do. You're washing, you're cleaning, you're looking after children. Improved strength and bone health, improving mental well-being, improving self-confidence and self-esteem, Then we look at a transition into a lifelong habit of physical activity and improved health behaviours, which then hopefully in turn will result in reduced risks of cancer-specific mortalities, all-cause mortalities, and reduced risk of reoccurrence in some cancer types. Okay, so that's our benefits. I said there's a lot of benefits to prehab, and that's just our favourite ones. Okay, so next slide. And Zoe's going to talk you through GM modelling.
So that's brilliant. Thanks for that, Kirsty. And one thing I will add to what Kirsty said already is that this is quite well known and you might have heard it already, but one of the things we do say about prehab is it's a bit like if you were running a marathon, you would absolutely do the training in advance to be able to run it. And that's, if you think about that very simply for prehab, you know, what you're going to be going through as a cancer patient in terms of surgery and in terms of potential treatments, you know, the physical toll it takes on your body, it's similar to coming up against a marathon, which is why it's so important to train and be prepared in advance of doing that. And so I think sometimes that's quite a simple way, but quite an effective way of thinking about prehab. So just talking about Greater Manchester, so we haven't really explained, but basically both myself and Kirsty are involved in the Prehab4Cancer service in Greater Manchester, which is a service that's aimed at all patients who live in Greater Manchester who've got specific types of cancer. So when they're diagnosed, people being referred in, and we'll go on to tell you a bit more about it because hopefully that'll help you to think about what you can be doing for yourselves. So starting off thinking about Greater Manchester for those of you that aren't local. So we wish it was that small. That's something that Kirsty always says whenever I see this slide. We wish it was that small. It's not. It's really big, and there's lots of people that live here. It's like a mini London. I mean, I always think my stepdad's from New Zealand, and there's actually the same number of people that live in Greater Manchester as there live in New Zealand. So that kind of gives you an idea of actually how many people live in GM. And the other thing about Greater Manchester is that actually, in terms of thinking about the types of people who live here and the challenges that the people who live here are faced with, we do have a lot of areas that are really disadvantaged. And we've got people who are at higher risk of early death through smoking, alcohol dependency, poor diet and air pollution. So actually, not only are we trying to support people to exercise and to physically prepare for the cancer surgery and treatment they're having, but we're also probably helping them to overcome some challenges they're already experiencing in terms of their health and their comorbidities and their existing levels of exercise as they're coming into their cancer journey. And I'm aware that on this call, we might have a range of different people who might have exercised previously, but are only getting back into exercise now, or people who might have been unwell for quite a long time as they've been coming into their cancer diagnosis and might not have felt able to engage in exercise. But actually they recognise now it's really something that's very important and want support and advice of how to do that. So the other thing that I wanted to just flag is that in terms of thinking about people's age when they get a diagnosis of cancer, so we know that obviously there's a greater likelihood of having a cancer diagnosis the older you are. And actually, again, I think sometimes people think that if they're, getting to be older, retirement age and beyond, sometimes it's seen, well, I'm too old to be exercising, it's not something that I need to be concerned with. Well, actually, for our service, this is just an example of some of the numbers of the patients that come through to our service, and a huge proportion of them are people in their 60s, 70s, 80s and beyond. So I think it's just to be really clear that actually not only do we need to think about how we help people overcome existing challenges around where they live and whether they're dependent on alcohol and other things, but also if you've got older people, how you support them to engage in exercise as well. So just going on to talk about our team of people in Greater Manchester. So you've got myself and Kirsty, and then also we do have lots of other people involved in the delivery of the programme and the design of the programme. We've got Dr. John Moore, who's a anaesthetist by background, who's our clinical lead, because for those of you that aren't aware, the anaesthetists really do like to think about how they can prepare people for going into surgery. They do what's called perioperative medicine, where it's thinking about if someone's going to be going under anaesthetic going into surgery, how they're actually going to manage that, their body's going to manage that, and making sure that you're reducing any complications when you go through that. So John's our very expert clinical lead, And then we've got Karen McEwen, who's our primary care lead. So she's a Macmillan GP. So she's also been involved in putting the project together. And both of them obviously are not here with us today, but always here with us in spirit, which is nice. This is a bit of a boring project management slide, but essentially what this shows is all the different types of people who've been involved in us putting the service together. So for those of you on the call who are other healthcare professionals trying to put Prehab together, I would really advocate making sure that you bring as many different people involved in cancer pathways into the delivery and design as possible. And importantly, that really does need to include people affected by cancer themselves. So actually, all these boxes kind of represent different groups of people and meetings that we have as part of the project. And all of them have people within those meetings who are cancer service representatives, so people who've actually experienced it themselves, or people who are family members of people that have got cancer. And for example, one of our brilliant people affected by cancer that's involved in our service is Tony Collier, who you might all know, who's a 5K Your Way ambassador, and somebody who has experienced prostate cancer, and he's a really big advocate of exercise and has been a huge supporter of our service delivery. But just to say, so the way we're delivering Prehab4Cancer in Greater Manchester, it's a mixture of the NHS and all the different organisations within the NHS in the whole of Greater Manchester, working very closely with GM Active, which is all the different leisure organisations, so all the local gyms that you would normally go along to, your swimming pools, etc. The organisations that are involved, and Kirsty's going to tell you a bit more about that in a second. So when we started to put this together, we did a focus group with people who've had cancer to get their thoughts and their views, and to make sure that we'd really considered everything we need to be able to effectively provide prehab for people. And some of the key points that came out, which I'm sure that a lot will resonate with lots of you on the call, is just how when you first get diagnosed with cancer, it can often feel that you're very your sense of control and your control really does go away, and you feel very done to by the healthcare system. You're almost on a bit of a conveyor belt where you don't really feel like you've got any influence over what's happening to you, which can obviously be very scary. And just understanding psychological theory, if the more you feel out of control, the more anxious you're going to feel. So it's going to have a massive impact on your mental health as well. So I think we understood that actually prehab's really important, partly because we're physically trying to prepare people, but also because we know that it actually helps people to feel in control and actually feel like they're taking steps themselves. And that doesn't have to be just before your surgery or just right at the beginning of your cancer pathway. I think getting involved in exercise and engaging in any kind of healthy behaviours all through your cancer pathway can help you feel more in control. The other bits that were really clear to us was that actually how important it is to involve the surgeons and the oncologists, because often they're the healthcare professionals that cancer patients trust the most, because they're literally putting their life in their hands. And also that people feel sometimes that they drop off the conveyor belt, as it were, when they leave hospital, that they kind of feel like they haven't got much support once they are discharged from hospital after having cancer treatment. So we've made sure that our service has got both prehab and rehab. It's not just the prehab. Actually, when people leave hospital, they come back to Kirsty and the team and they continue to have rehab. And actually, for some of the evaluation we've done so far, I think what patients have said is that they feel that they've got this support, not just from the team who've been with them the whole way through, but also other patients who they've been in the service with. They've got that psychosocial support and that, that group of people who are experiencing the same thing as them at the same time. So yeah, and I just love this slide because it's a pretty slide. It's visual minutes of the meeting that we had with all the patients. So just to show you that we really have tried to consider patients' needs when we put the service together. So I think it's really important when you are thinking about prehab, for those again on the call who are healthcare professionals, about all the different members of the clinical teams that need to be involved, and how this isn't one expert who's going to answer this question. It's actually lots of different people who need to be involved. And for patients and family members on the call, what I would say to you is don't be scared to speak to your clinical teams about prehab and rehab and about what you need and what your specific needs are related to your current level of your cancer and other health conditions. Because even if you're in touch with your nurse or a dietitian or a doctor or whoever it is, it's incumbent upon all of us to support you. And ultimately, everyone who works in the NHS, they just want to do what's right for their patients. So don't ever feel that you can't ask those questions, because they're really important and people will always want to be able to support you. So it's just really important to understand that actually all of these different people listed here are really important. And actually, but ultimately, the person who's the most important is the person experiencing the cancer, and they're the ones who are going to be doing the prehab. They'll get the guidance and the advice from somebody else, but they're going to be ultimately responsible for getting involved and doing the exercise and taking control of the situation. So just in Greater Manchester at the moment, because it's kind of something we're just trying and starting out with, we've only had funding to do this for people with lung cancer, colorectal cancer and esophagogastric cancer. And it has been mainly focused around surgery, because in terms of the medical research about prehab, there's a lot more research and evidence that supports people who are going through surgery, just because we understand how much of a physical onslaught surgery can be for people. So it makes sense that actually you really need to do that preparation for someone beforehand. However, I think what we do know is that it's incredibly important for someone going through chemotherapy and radiotherapy as well. And anecdotally, we know that, and we just need to gain more evidence to demonstrate that. So this is just an example of the pathway for patients coming into our service. So essentially, when someone gets that first early diagnosis of, for example, lung cancer on this slide, but it's equally colorectal cancer or OG cancer, we consider various different pieces in terms of from a clinical perspective, where they're up to, and then they get referred into the prehab service and get contacted by the service really quickly, which Kirsty will go on to explain shortly. But again, for the medical people on the call and people from the NHS, it's just to show you the kind of different considerations we would make about a person, because ultimately what you want to do is make sure that anything that is delivered to a patient is safe. And anyone who wants to engage in prehab and rehab independently, you know, if you don't necessarily have access to a service locally to you, that's why it's so important that you speak to your clinical teams or your GP or whoever, because you really need to understand, you know, what's right for you and what's going to be safe for you to engage in exercise. And it's not just surgery in our service. We do actually have patients who are going through chemotherapy, radiotherapy, and other treatments, specifically in the lung pathway, but also people who are having chemotherapy kind of around their surgery for colorectal and OG patients. So I'm going to hand over to Kirsty now.
Thank you. Thanks, Emily. Right, so as Zoe said, it's a joined up approach between the NHS Trust and the clinical teams, but also the leisure teams, which is where I come in. And the reason we can do it through such a vast area as Greater Manchester, which is 10 local authorities, is because we have an organisation known as GM Active, which represents the 12 leisure and cultural trusts that run the local authority leisure assets and cultural assets across the region. And they all sign up to GM Active, and GM Active's tagline is "We move as one." So it's all those 12 organisations working as one organisation, and that's why we can go cross-borough, and there's no postcode lottery in GM, thankfully, now that we have this sort of webbing across the borough. So that's the 12 organisations there. Some are councils, as you can see, some are leisure trusts, some are firms. There's a whole host of different types of setups of organisations, but we all agree that for Prehab4Cancer, we come together as GM Active, and that's why we can deliver over such a vast geographical area. So next slide, please. Oh, see, I told you, hidden animations.
You're just trying to keep me from going to sleep, aren't you?
I completely forgot that I did that. That was very impressive. Okay. So that's our logo. So a lot of people, especially those that may have grew up in the late 80s, early 90s, remember highlighters, like had the 3 different colours on your highlighter, and that was the inspiration for our logo. No, not really. It's just to show that we are a 3-point programme, and the 3 points are exercise, nutrition, and well-being. We go onto that three-pronged approach because we know that's very important to patients after our user representative groups and things like that. And we know that those three things can really impact on outcome measures. And all 3 points of our program are assessed at very strict set times using validated measures. They are constantly monitored. We have a lot of contact with the patients, so they are constantly monitoring nutrition and well-being. And we have very, very well established and agreed protocols between our team as the leisure provider and also the clinical teams, and how we raise concerns and feedback information into those teams. Again, so we are all working in that one team, which is the patient's team. And we have our expert subgroups for each of the 3 points. So we have the nutrition subgroup, the wellbeing subgroup, and the exercise one. And they shape and help us remold the service when needed. Okay, next slide. So this is our assessment overview. So Zoe alluded to it earlier that we have we do fit into the 62-day target, and because of that we are very quick to turn referrals around. So at that point of NDT, which I spoke about, when the referral is made, we have 48 hours to contact that patient and to book them into an assessment. Then the assessment happens, and that's our baseline assessment. If somebody is having neoadjuvant or pre-surgery chemo, we will also try and do an assessment after that. But if they are not, then we do a pre-op assessment, which is usually within 5 days of surgery. Post-op assessment ideally is at 6 to 8 weeks post-surgery, but if the patient is not feeling up to it at that point, we will delay it to a point where the patient is feeling comfortable enough to do the assessment. And then we have 12 weeks of rehabilitation, and we do the 4th and final assessment at that point. All the assessments are exactly the same, and we do the same test at all of them. And like we said, we look at the exercise. So that's our functional capacity test. So we chose an incremental shuttle walk test or a 6-minute walk test, hand grip dynamometry, and a 1-minute sit to stand. We have wellbeing questionnaires, and then we do our health checks, and our nutrition is part of our health checks and our questionnaires, and also the hand grip dynamometry. So next slide, please. So this is a simplified version of our program model, although it does look very busy, I appreciate. So on the left, it shows the assessment is done, and then we categorize patients into a supervised or a universal arm. Supervised is where people require a bit more support, and that could be due to comorbidities, frailty, cognition, confidence in the gym, anything that requires more support. We will provide increased support for that group. Then our universal group is more less complex patients who are quite happy to get on in the gym. We give them a program and they'll follow it, and we'll bob in on them once a week or so. We also have exercise prescription guidelines that people are categorized into. So we have something called a rehit protocol, which is loosely based on interval training. Any patient that for any reason can't do the interval type training will go into a continuous progressive steady state CV exercise. For those people on the call who are exercise specialists or AHPs and working in prehab, we've got the target training zones there. So for continuous, it's 40 to 70% maximum heart rates. They do progressive intensity, and we use pain and discomfort scores on the muscular strength and endurance components. And in the rehit, we push to up to and even over 80% maximum heart rate if somebody has done an assessment where we deem that safe. And again, MSE is monitored, and both groups, we push to get 3 sessions a week. Then they'll go off for surgery. And then our rehab is much more patient-centered. We do gym programs to get their functional capacity and strength back up, but we also include all the likes and dislikes. We look at goal setting, and it's really about promoting long-term exercise or physical activity adherence to the improvement of their quality of life and their ongoing health. And we also have really positive exit strategies, making use of the GM Active programs that are around. So next slide. This is the same slide, but there's a brand new green box, and this indicates this is our treatment model. So the only thing that changes at treatment is once somebody starts their treatment, there is no expectation or target number of sessions. The patients receive supportive phone calls from their exercise specialists, advising them and educating them around fatigue management and side effect support. We also offer them some level of activity if they are feeling up to it, but their program is very flexible and constantly adapted to take into consideration how they are feeling on their treatment cycles. But the rehab is exactly the same as somebody finishing treatment as somebody who's just finished surgery. It takes exactly the same amount of time and we focus on the same things. Okay, so next slide. Okay, so this is our year one overview, headline figures, if you like. So we launched in April 2019, and just before COVID, we were practically a year old. We'd had 1,000 referrals, an 80% engagement rate. From initial engagement to starting the exercise was a 94% uptake rate. Because of our GM Active contacts and the way GM Active work, 100% of patients were accessing the service local to them in their boroughs, in their local leisure centres. Participants were showing clinically significant improvements in fitness during the prehab phase, and also improved recovery post-surgery, and nutritional status is maintained. And anecdotal evidence from people working within the clinical teams was showing that patients demonstrated improved confidence, motivation, sense of control, and overall patient experience. Okay, next slide. Then COVID hit and we decided to continue our service because we wanted to remain open. So we redesigned the service. It practically looked the same, but everything that was face-to-face went to telephone or video calls. So referrals remained open. We were asking the clinical teams to send us the physiological data instead of gathering it ourselves. All the timeframes still existed, so 48 hours from receipt of referral. All patients were given a tailored home exercise pack, which was built for them based on their assessments. And the contacts were 2 times a week of telephone or video calls for our targeted, and 1 time a week for universal. We then developed a more digital platform. So we went onto YouTube, live exercise sessions, digital heart rate monitoring, remote heart rate monitoring, but we kept the assessments there and our adherence was maintained. Next slide. This just shows our home exercise guide and that it is adapted to everybody. So it's not a standard one. It's not even, they're put into a group based on assessment. Each and every single exercise is built for a brand new patient, and it will get changed as they progress and go through treatment or into surgery, and it is posted out to their house. It can also be emailed, but we are finding that people like a paper copy even if they've got access to email. Okay, next slide. This is our timetable. So we have 13 virtual classes a week at the moment. As the eagle-eyed ones in the call will see that there is early morning, evening and weekends as well, and there is an evening session at 6:30 tonight, which I am teaching, and that's why I am sat in my uniform, so we'll definitely be done by 6:30. And we are getting really, really good uptake. We do everything from seated Tai Chi all the way up to high intensity interval training, so there is something for everybody. Next slide. Okay, so exercising in the run-up to your surgery. So these 3 pictures just highlight some of the perceptions of exercise. If you walked into a gym, there's lots of people lifting big heavy weights, very scary looking people, very fit looking people. They're either lycra clad, like the lovely Mr. Motivator, who is making a comeback in lockdown. He's doing really well, but the lycra clad is still a perception that you'll walk in and everybody's got all the gear, and you might have all the gear and no idea, and that's a scary prospect. And then there's also the picture of a really busy gym and really confusing equipment, like a treadmill. The floor moves, but you don't. That's very confusing, and how you work it and how you get on it and what speed you put it at. So perceptions of exercise, they're a massive barrier to people wanting to exercise, and especially somebody who's affected by cancer in the run-up to surgery. it's even bigger, that sort of perception of, oh my God, you have to be really fit to exercise. So we're trying to break that down a lot. Next slide, please. The common barriers. So when we've been speaking to our user representatives or people in our program, we've come up with some common barriers. So if Zoe hits the button again, they will pop up. So we've got fatigue, side effects, fear, enjoyment, time, motivation, safety, confidence. If we remember back to the start of this presentation, a lot of those are the benefits of prehab. So the benefits of doing prehab is to lower somebody's fatigue, which is a barrier to exercise. So you can see there how doing prehab or rehab is going to lower these barriers to exercise as people start to feel the benefits. Same with side effects. So the side effects of treatment stop people from exercising, but we know that we can manage some of the more serious side effects of treatment if we get people active before, during, and after their treatment. So the barriers very much align to the benefits of prehab. And once we can get people thinking that way, then it's easier to break down those barriers and encourage people to become more active and exercise more. Okay, next slide, please. So physical activity and exercise. So some people on the call will know that there's a difference between the two and some won't. So there's very scientific explanations. There's physical activity defined as any bodily movement produced by skeletal muscle that requires energy expenditure, or in simple terms, moving. Just move, that's physical activity. Whereas exercise is activity that is planned, structured, repetitive, purposeful in the sense that the improvement or maintenance of one or more components of physical fitness. Now that's a mouthful. Basically, that's movement with a purpose. So physical activity is movement, exercise, movement with a purpose. That's how I look at it, and that's the most simple way to look at it. So next slide. We'll look at physical activity first. So like I said, it's just movement, but in order to get benefits, we have to do something which is called moderate intensity. And we'll go on to how you can measure moderate intensity later. But basically, that's just that feeling of getting a little bit warmer, breathing a little bit heavier, feeling your heartbeat a little bit quicker, not pushing yourself so you are totally exhausted, just an achievable effort is how we do it. So things like gardening, shopping when we are, well, we're technically allowed to shop now, but things like shopping and carrying bags instead of a trolley, and very excitable cleaning like that lady there who is hoovering with some gusto in that picture. So you can literally make any sort of movement activity if you push it. Okay, next slide. Then we look at exercise, and like I said, exercise is movement with a purpose. So we've got 5 components of fitness. There's muscular endurance and muscular strength, that's 2. Cardiovascular fitness, heart and lungs, 3. Flexibility, so your joints and range of movement and how you move. And then body composition, nutritional status. They're the 5 components of fitness. And if you think about things that would help those components, so muscular strength and endurance, looking after your muscles, how do we do that? You can do a weight-based program using dumbbells, resistance bands, or you can use your own body weight. So sitting down and standing up off a chair, it's a type of squat, it's a body weight exercise. It will improve somebody's muscular strength and endurance. Cardiovascular exercise, you've got things like walking, jogging, rowing, cycling. Anything that gets your heart to beat a little bit quicker, makes you breathe a little bit harder, is your cardiovascular system improving. Flexibility and body flexibility is all about your stretching and your movement. So you've got things like your yoga and your stretching and range of movement exercises. And then body composition, so there's exercises and exercise intensities that will definitely help somebody's body composition and change somebody's body composition. And then there's your nutritional status that also looks after that. Okay, next slide. There are guidelines. So we have UK exercise guidelines, and they've not changed for a while. They've always been 150 minutes of moderate intensity, but sometimes the visuals or the way that they present them changes. And I've got to say, this is probably one of the best ones to come out in recent years. It's a very simple graphic. It's be active, sit less, build strength, improve balance. And it gives you the times to do. So it's 150 minutes of moderate intensity, strength training on 2 days, sit less, move more, and improve balance. And it gives examples of how you can do that. So sit less, don't watch as much TV, improve balance, have a little dance in the kitchen. So it's really simple ideas to get you moving, sitting down less, and improving those components of fitness. Okay, next slide. Then we recently, I think it was last year, there's an organisation called the American College of Sports Medicine. And for those that don't know what that is, we abbreviate it to the ACSM. And they produced the effects of exercise on health-related outcomes in those with cancer. And again, it's one of the better graphics that come out. And not only is it just a graphic, but it goes into real specific detail for aerobic exercise. So like I said, the stuff that gets you breathing a little heavier, gets you a little warmer. So that's like you're walking, you're cycling, you're jogging. And it gives you how many days for how many minutes you should do each day and at what intensity. It does the same for resistance, and it also does the same as a combination. So it's a really good guide to go to if you're starting out and you have no idea. It's a really good guide to go to. Look at an outcome. If you are struggling with cancer-related fatigue, that's the top one, and it gives you a dose of exercise to do to combat that. It's a really, really good graphic. Okay, and next slide. So we've talked a lot about moderate intensity and the intensity of exercise, and I did a bit of jargon earlier about training heart rate zones. The way we do it and the way that we get a lot of good feedback and a lot of good engagement is thinking of the rate of perceived exertion, or RP scale, and we use the simplified 1 to 10 version. There is a 6 to 20 version, but our users and our participants prefer the 1 to 10 version. And it's basically a scale of 1 to 10. If 10 is you have just finished the worst marathon of your life and you are absolutely exhausted, that's maximum effort. It's impossible. You can't continue that type of exercise for long. And then 1 is sat down on the sofa watching Coronation Street if you're up north, or the whatever the down south one's called, the EastEnders.
EastEnders.
Well done. Or watching telly. So we say that moderate is 4 to 6 on that scale if you think of numbers, and that is that breathing a little bit heavier. You can hold a conversation, so you're not panting. It's comfortable, however, it is challenging, and that's what we want. We want it to be challenging because that's where we're getting the benefits from, but we want it to be a comfortable sort of feeling. Like, yes, you can do this. It's a positive thing. You're pushing it a little bit, but you know that you can achieve it. And that's how I would suggest that people monitor their own intensity if that is what you're looking to do. Next slide. Oh, no, this is my last slide, I think. So we asked our current participants and some of our past participants, what would be the top tips? So when I was putting together this slide, I thought, and then as soon as I started typing it, I thought, why am I typing this list? This is not the list for me to type. So I asked people, the top one was listen to your body. Okay, and we talk about intuitive exercise. So it's learning to listen to your body and how you feel. And then you'll understand how you can push it and what you can achieve that day. So really important, listen to your body. Find something you enjoy, don't be scared. It's okay to feel out of breath. That is exercise. We get a lot of people who are nervous about feeling out of breath. If you do it by using that intensity scale, yes, you'll be out of breath, but you'll be able to hold a conversation so you won't be gasping for air. So it's really important. It's okay to feel out of breath. Activity monitors increase motivation. Get someone to do it with you. Again, that motivation and support. Set a goal. Again, motivation. Routine. I know Tony, our user rep, who I think he's on the call, talks about consistency is key, and he's currently on a 340 odd day consistent running challenge, which is amazing. Rest days are important. Again, that hits listen to your body and get advice. Talk to your clinical teams, talk to your local instructors if you are lucky enough to have them. And finally, anything can be an activity. Climbing the stairs with laundry. You just have to change the way you think about boring domestic jobs, which is one of my favorite quotes I think I've ever had. Okay, and then back to Zoe.
So I'm just conscious of time, so I'll whiz through the last few slides. But basically, it's just to let you know that the patients that have gone through the service so far, and we're up to nearly 2,000 patients, have hugely benefited from engaging in prehab and rehab around their cancer treatment. And so here's just some of the kind of quotes. And actually, Tony, who's on the call, and Steve, one of our other patients, service user reps, they actually conducted focus groups speaking to people who'd been through Prehab4Cancer and asking them what their thoughts were, because they really wanted to know, is there anything that we could do better? And they really wanted to know any kind of constructive criticism, as it were. But this just shows you how much patients have benefited from it, how they've really thought that it's helped them in terms of their motivation, their confidence, feeling positive, feeling stronger, feeling less fatigued. So we just really wanted to show this. And actually what we have been doing with the University of Manchester is a study where they've actually researched, speaking to quite a few of the people who have been part of the service to get more detailed information. And some of the information that's come out of that study so far is actually just how much people feel kind of the psychosocial support, the support from being part of a prehab and rehab service. And for those that can't access that kind of thing locally to where they live, even if you just go along to your local leisure centre and get involved with like the local leisure teams, often you'll find there'll be cancer rehab qualified people working locally, whether it's in a leisure organisation or whether it's just somebody working locally, and just having that support from either them or from other cancer patients who are going through something similar can be really helpful. I mean, that's what 5K Your Way is all about. So even just going to 5K Your Way, on every Saturday, going along and doing the park run with a group of similar minded people, I think is really, really helpful. I just wanted to say one final point around just as well as talking about all the physical benefits of exercise. We know how much it goes hand in hand with someone's mental health, and how people's mental health can be completely blown out of the water when you get that diagnosis of cancer, that really incredibly scary diagnosis, which most people will experience some level of anxiety or depression when they get that diagnosis and as they go through treatment. So it's just to let you know that exercise has absolutely been proven to help reduce that experience of negative mental health symptoms. So if you are feeling anxious, if you are feeling low, or if you are feeling fatigued, even if you don't feel convinced about the need to do exercise from a physical perspective, I think it's just knowing that actually that's going to really help you in terms of overcoming any of those kind of mental health symptoms that you might just find that by doing it, you just feel more in control and more able to cope. And then just finally, we've harped on about prehab and rehab and why it's so important, but just some of the examples of our outcomes so far from what we've done with our service. So we've shown that we can absolutely improve people's cardiovascular fitness when they come to us prior to their cancer treatment. We've shown we can improve their muscle strength in a really short period of time, 2 to 3 weeks, you can get someone to have improved strength. We've shown that we're able to maintain people's nutritional status, and actually really prepare someone nutritionally before they have their treatment. And then, like I said before, just that reduction in that development of mental health symptoms, and just kind of overall improved quality of life that people experience. And there's a lovely quote there from one of the patients just about how beneficial she's found engaging in prehab and rehab as she's gone through her cancer pathway. Just for you, if you're thinking, well, hang on a minute, I don't live in Greater Manchester, so none of this applies to me. Well, that's just not the case. There's lots of other things that you can be doing. I'm sure you're all aware, but there's lots of apps you can get on your phone to support you to exercise. So, for example, Map My Walk, Strava, sometimes just having an app on your phone and every time you do a bit of exercise, recording what you've been doing and keeping track can be incredibly motivating to keep on going and to connect with other people. Obviously, there are lots of local groups, so there's 5K Your Way, but often there's local walking groups, local exercise groups. I'm part of a running group locally to where I live, and it's been absolutely the thing that I've needed to get me through lockdown and to keep me running for the last year. And then also there's lots of different exercise trackers and heart rate monitors. We use MyZone within the service. Of course, there's lots of other ones like Polar and other things. But if you're new to exercise and you really want some advice and guidance about what you should be doing and what zone you're working in, those can really help. And then finally, a little plug of our website. So we have got a website, which is www.prehab4cancer.co.uk. And we've got some brilliant videos on there of Kirsty and the gang doing exercise sessions. So even if even if you just go on there, you can go onto our YouTube channel from the website, and basically there's just lots of videos of doing different types of exercise. So some of the kind of more gentle, like Tai Chi, but then some of the more intense exercise sessions, like the rehit as well. And we've got some brilliant just general advice about what exercises you can be doing at home, which again, Tony, Tony's been absolutely brilliant. We've got some pictures of him doing some exercises at home, just to show that it really is something that everyone can be doing. And it's been brilliant that he's able to do that for us. Finally, if you want some more information, if you really want to go away and do some reading, Macmillan have created this Principles and Guidance for Prehab document, which is available via their website, of which myself and Kirsty, John and others have been involved in from Greater Manchester. You'll see pictures of Kirsty in there if you have a look. So I would, if you do want to know more and you kind of somebody who's a bit geeky and likes to read a bit more around what you're doing, then there's a lot of information in there that can help you. These are all the different people that have been involved so far supporting us in Greater Manchester, so just a big thank you to them. And then just finally, you've got this, you can do it. I know it probably sometimes might feel impossible, but absolutely, we know we've got the experience in Greater Manchester of lots of patients who've got cancer exercising and having fantastic outcomes as a result. So I'll stop sharing my screen and then we can just go to questions.
Yeah, I'm in charge of the question box, I promised, didn't I? So
I'm going to butt in and say a huge thank you on behalf of everyone that's been listening to Zoe and Kirsty. I think people giving virtual thumbs up and smiles. So that was really interesting. I learned absolutely loads, and thank you so much for taking the time to go through all that. I think everyone was left thinking that we wish the whole of the UK could be like Greater Manchester. I guess you hear that a lot. So yeah, that was fantastic. I think Kirsty,
on that, Georgie, there are other prehab services. In fact, we've got a couple of people here who are from other prehab services, so it's not just our one. There are a few others, and there is Safe Fit, which is an online thing you can refer yourself to. So there are, but I appreciate they're not everywhere, sadly. So do check out. There might be something available to you in your local area. If you ask your GP or doctor or nurse, they might know of something already that's in existence.
Yes, definitely. And while you're pointing that out, we've actually got another workshop on the 28th of April, and that's with the guys in Harrogate called Active Against Cancer, and that's specifically so please sign up. Little plug at that while I'm saying it. That's specifically on building strength for walking and running, so to prepare for parkrun, for 5K your way coming back. So that they're going to focus specifically on that with some not just kind of chatting, actually some physical ideas and videos and things like that as well. So yeah, that will be coming up in 2 weeks. So that is another example of kind of prehab work. But what I'm trying to say is the Greater Manchester one is brilliant, and we obviously are very, wish it could be everywhere, but do check out, there will be some in your local area as well. So Kirsty, I'll pass over to you to there's quite a few questions coming in. Thanks.
Trying to keep up with them all. So we've got Leon. Hi Leon. Can we give examples of most difficult patient case you come across? Difficult as in difficult patients, or difficult as in medical difficult? There's a lot of interpretations of the word difficult there. So why Leon responds. Holly has asked, Zoe, do we have any data about the impact on hospital services, i.e. reduced length of stay for prehab?
So we have some kind of exciting preliminary data which shows that we've reduced hospital stay by a couple of days for the lung patients. which I got very excited about and jumped up and down when I saw that. And we are in the process of going through some work at the moment. As you can imagine, with the last year with the COVID pandemic, a lot of the kind of data people that you'd want to be involved in that kind of stuff have just been completely preoccupied, quite rightly, on the COVID pandemic within the NHS. So we're just getting into a situation now where as less people have COVID and there's more space within the NHS to be focused back on other things, we've got that support from those kind of IT people to support us to look at that. But I think logic tells us that probably we are really massively helping. And I know certainly patients, like I remember one patient said that their doctor had told them that they would probably need to spend 3 or 4 weeks in hospital after their surgery, and they did prehab and then they were out within, I think, 5 or 7 days, you know. So I think anecdotally we know that we definitely are, but it's something that we're in the process of trying to understand at the moment, because we really need to show, sadly with the NHS, you always need to show that you're saving money. So as much as we also want to make sure that we're obviously improving the patient experience as well.
Okay, next up, Brid Dunn, who's just followed me on Twitter, so thank you very much, Brid. Is the wellbeing aspect of the programme mostly managed through the exercise programmes, or are there broader supports interventions to address this? So if Zoe don't mind, I think I'd take this one. So we do assess wellbeing, so the exercise team do assess with the questionnaires that we look at. And then we make, from that assessment, we can then make a judgment whether that person needs to be referred back to their clinical team for wellbeing support, or if we feel that it's that they're good, they don't need that much support, we constantly monitor it. And we are also, again, quite lucky that we have a lot of local organisations that we can signpost into in the individual boroughs who are either volunteer organisations or low-level mental health and wellbeing support organisations, which we can advise people to go and self-refer to. We also have 2 Maggie's centres. If you've heard of Maggie's centres, we have 2 of those, and we also make use of our Macmillan centres as well around the borough. So the wellbeing aspect is, again, it's that bigger team. Yes, we are a little bit of the assessors and the monitors of, but we have a bigger, more organisations to help us as and when we need it.
Can I just add as well that the research I was telling you about from the University of Manchester, again, I think what that's shown us so far is just how much patients feel that they've had that psychosocial wellbeing support from the service. Because I think what the team do really brilliantly is they really do have that regular contact with patients through the whole process, from when they first get diagnosed, before treatment, and then afterwards again, which sadly sometimes within the NHS, although you've got contact with your nurses and other people, it can often be quite infrequent. So I think we know that actually the team is brilliant at just being there to support patients. And sometimes that's all you need, that ability to talk through what you're going through and to really share your experience and get the support. So I think actually we suspected that we were providing a really high level of wellbeing support. And I think some of the research that's being done around our service has kind of demonstrated that that's true. But equally, I think it's recognising that people do need more psychological support for patients with cancer. And that's certainly something in GM that we're trying to achieve.
Okay, Leon's come back, and difficulty was in reference to motivation and physical limitations. So yeah, motivation can be an issue, especially for our treatment group, just because of the relentlessness of treatment. If it's radiotherapy, it's daily for 20 sessions or so. If it's a chemotherapy cycle, it's that up and down that we have to deal with. So yeah, we do face quite a lot of motivational difficulty. The way we get around that is by supporting goal setting, and really strict goal setting to increase patients' motivations. And the intuitive exercise really motivates people. So we talk to people a hell of a lot of listen to you, but sorry, my dog is doing roly-polies behind me and distracting me a little. We talk to people a lot about intuitive exercise, and that is fatigue management, basically. And that also helps to improve somebody's motivation, because then they know that it's a specific program for them and it's adaptable, and because it's adaptable, it's going to be achievable but challenging, and it really helps their motivation. And especially if you've got that goal setting correct at the very start, that really does help. Physical limitations, that's where our robust assessment comes in into its own. Yes, our assessment, it is robust and it does take quite a lot of time sometimes, but it's to get to the nitty-gritty of those physical limitations. So the exercise we then prescribe is tailored and specific to that person that they can achieve. So physical limitations shouldn't then be an issue because we are prescribing it exactly what they need and at the right intensity. So I hope that answered that question, Leon. Do you use CPET? Well done, Leon. We do use CPET. I think Zoe's probably the best one to talk about this because she knows where it comes in more than
Yeah, so CPET, for anyone who's not aware, is cardiopulmonary exercise testing, and it's kind of seen as the gold standard of trying to assess someone's cardiovascular fitness in advance of them having a surgery or other operation, or other procedures, other treatment. It's often completed by anaesthetists or exercise physiologists working in hospitals. And it's often used with patients who are identified very early on in their cancer pathway or other pathways, that they are potentially going to be at risk going into their surgery, because really what you don't want to do is you don't want to operate on somebody if you've got concerns about how they're going to survive that surgery and whether they're going to have any complications, etc. So that's part of the reason why often CPET's done. In Greater Manchester, we do have quite a few different CPET services in all the hospitals. So we've actually got 10 different hospitals that refer into Prehab4Cancer. So because that's a hospital provided service, we're kind of a little bit at the mercy of what's available for patients in specific areas. But what we have tried to do with the delivery of Prehab4Cancer is we've tried to really impress upon all the clinical teams how important CPET is. And actually for some patients that we really want it to be done for those even before they come to Prehab4Cancer, because actually for some patients, if we're really concerned about their ability to engage in exercise and the kind of potential risks of them coming in exercising, we'd want to make sure they've had that CPET done before. And when I say that, for those that can't visualize what I'm talking about, it's essentially getting someone on an exercise bike and you've got a variety of different monitors and breathing apparatus and other things, so you can really tell, you really make someone work as hard as they can on an exercise bike in a clinical setting with doctors there, and then they can really tell what's going on for someone with their heart, with their breathing, with their body. So that's what a CPET is. But as you can imagine, it involves people coming into hospital, and especially at the moment with COVID, I don't know if you're aware, but anything where there's heavy breathing involved, it's considered to be quite high risk in terms of being able to pick up COVID. So there hasn't been as many CPETs completed in the last year as there normally would be. So the short answer, that was the long answer. The short answer is yes, we do. However, again, it's not done within the service. We very much have made the Prehab4Cancer service something that's happening in people's local communities, because what we want people to do is A, not feel like they've got to go into hospital, which are often scary, negative places related to their cancer treatment. And B, we want them to continue to do their exercises and to continue to do physical activity after they leave the service. So often if people are doing that in their local community leisure centres, they're more likely to continue to do that. And just feel normal and just go to the gym just the same as anybody else would do, regardless of the fact you've got cancer. So we kind of keep it a bit separate, but we do very much link in with the CPET teams.
And just to finish on that, Leon, we could, when we were doing face-to-face delivery as well, as a team, if we felt that the patient was a little bit too complex for community care, we could go back to the clinical lead, Dr. John, and ask him to do a CPET on particular patients, and he would do that and send us a report to get them exercising safely. We had a question which I missed, so Georgie, thank you very much for sending it back. How do we cope with already conditioned patients who are struggling with the idea of prehab, rehab and treatment? So already conditioned patients is people who you would describe as probably already quite fit and able, and the way that we cope with those patients is we do the assessment, and sometimes, yes, we do get the feedback, and also the clinical teams might not refer them because they think that they're fit and able. So we do the assessments, and the assessment will show that functional capacity, so their baseline fitness, is quite high. And it's very important about education for those people, because it's more about reining them back to say that, yes, your fitness is very high and your functional capacity is really high, but we need to now be careful and monitor this, and we need to keep you where you are and maintain that fitness. But it's about re-educating at that point about exercise and fatigue management, and activity, and making sure that they are listening to their bodies, that once treatment starts, or if they've had surgery, that their goal setting is adjusted to take into consideration the physiological impact of treatment or surgery, and rein people back a little bit, and make sure that before the treatment starts or surgery comes, that we have prepared them the best we can mentally to educate them about their physiological capabilities after treatment starts and surgery, so that self-confidence and is still there, that their body is going to build back up. And that's where we readjust goals and readjust expectations correctly, in order to make sure that we support somebody through that. We've got, how have patients tolerated the HIT protocol? So the HIT protocol, like I said, it's based on a HIT protocol. We call it ReHIT. And because we do that assessment where we can work out somebody's training zones, or intensities, like I showed you the 1 to 10 scale, we can give our patients, our participants, numbers to hit or training zones to hit. And because we do that assessment, and that is really strictly formulated, we had help from James Steele over at UK Active. Well, he's not UK Active anymore, he's just left there, but he helped us with that protocol. And because we do that assessment and we can get that prescription right, yes, it is really challenging. It does push people. It, like a ReHIT protocol for anybody, will push them. But it's then our job as a team to educate and support somebody to push themselves that much. So again, it's making sure we get that exercise prescription spot on. So yes, it is challenging, but it is achievable, and therefore the feedback we get is better. If we got that assessment wrong and we didn't have the strict formulas and we didn't have the correct prescription, then the tolerance would not be there. But we take great care to make sure that that is done correctly. So therefore the tolerance and the feedback we get is pretty good. And then, oh, they keep coming. Okay, I do not live in GM. Am I able to obtain a copy of some of the slides?
Kirsty, I've just tried to answer that for that person. And yeah, and we can send the slides as well to Georgie, so that she can, we don't mind sharing those, which have got, but I've tried to make sure URLs are on the slide, so actually then people can go and find the information that they need.
Yeah, yeah. Good stuff. And then there was another copy of the assessments to share. That's on our website, isn't it? So,
yeah.
Okay.
Excellent. I think that's it. Really great if you don't mind sharing the slides. If you email them to me, then I can email them to everyone that signed up, because there was a few people as well that signed up and then couldn't make it, so I know they'd really appreciate it. So thank you. So
put them on your website as well, Georgie, please do. If you, I don't know if you keep like recordings and things, if you want to put the slides as well, that's as well, you can do that.
Oh, excellent. Thanks, Zoe. Yeah. So we'll put this on our website and on our YouTube channel, and with the slides as well. So then I'll email everything over to everyone. So thank you so much. Well, firstly, Zoe and Kirsty, that was excellent. And thank you very, very much, everyone, for listening and for all your brilliant questions. Like I said, the next workshop's in 2 weeks' time. If there's anything else you would like to kind of hear more about 5K Away or anything like that, you'll get my email when I send you an email anyway, but it's info@5kaway.org. You're getting lots of excellent feedback, Zoe and Kirsty, excellent, brilliant, thank you. So thank you so much again, and thank you all for listening, and have a great afternoon.
Thanks,
excellent,
everybody.
Thank you very much. Thank you. I think if